Hi, my name's Dr. Nayo Williams. I am double boarded in Ob-Gyn as well as maternal-fetal medicine. Specifically for maternal-fetal medicine, we are the subspecialists who take care of high-risk pregnancies. And those pregnancies can be high risk because of either maternal or fetal issues. So when I was in medical school, I really had a hard time choosing what I wanted to do because I loved so many different aspects of medicine. I started my OB-GYN rotation and immediately fell in love with the fact that with OB-GYN, I got to combine everything that I loved. I got to do surgery, I got to have continuity of care with patients, and I got to see patients in the hospital setting. And then further, once I was actually practicing as OB-GYN, I realized my true love was with maternal health. And so that's what made me decide to subspecialize in maternal-fetal medicine. So I see a wide variety of patients in practice, all the way from preconception, so prior to pregnancy, throughout their pregnancy, and then even during the postpartum period. In maternal-fetal medicine, I like to say that we sort of split things into two pieces. We have maternal concerns and we have fetal concerns. Sort of our most typical maternal concerns that we might see are things like hypertension, diabetes, and these could have happened prior to the pregnancy or during the pregnancy. The fetus, so in terms of for babies, the things that we see most commonly are going to be abnormalities with babies, structure on their body, most typically the heart. As a maternal-fetal medicine physician and working in an MFM practice, we do have some tools at our disposal. And one of those most important tools that we have is our ultrasound machine. We have sonographers that have many years of expert training in order to be able to do maternal-fetal medicine ultrasounds that are more detailed in nature, especially in those cases where there is an abnormality present. There are certain types of measurements and views that we have to get so that we can understand better what's going on with the baby. The other thing that we're able to do is what we call diagnostic testing. So this is for those families that want further information genetically of what's going on with baby. We offer testing with amniocentesis, chorionic villus sampling as well. And then in some rare and extraordinary cases, sometimes we need to take additional amniotic fluid off because there's too much present. Sometimes we even need to add some amniotic fluid in. So these are all of the specialized procedures that we do here in our practice. So I would say my approach for patient care is very patient-centered. I take the approach that the first thing I want to do is get to know the patient, understand a little bit more about their history, and then from there go into the counseling that's needed for the pregnancy. When I do this counseling, it's really important that I provide families with all of the information they need so that an informed decision can be made. So with your first visit to our office, you can expect first getting your ultrasound performed, and then once you have your consultation, we will review all of your history as well as the ultrasound, and from there have further guidance that might need to be given for the pregnancy. We're here also then to answer any questions that you might have and create a plan going forward. So when we have patients coming to see us for chronic medical illnesses, one of the best things that can be done prior to that appointment is making sure that you have all of your records from other subspecialists. I see a lot of patients during the course of a week. I feel really privileged to be able to take care of women and their families during some of the most joyous times of their life, but also during some of the lowest times in their life. And one of the things that I've encountered is many times patients are hesitant to reach out because they feel like maybe they're being a bother And the one thing that I tell all of my patients is that you are never a bother, and that if you feel as though there's something wrong and you need to go to the hospital for evaluation, please don't hesitate to do that. That there's always going to be someone there who can evaluate you and make sure things are okay and give some extra reassurance if needed. We want to be here to support you during those times so that we can reach our goal of having healthy pregnancies, healthy moms, and healthy